Recognizing RLS, the phenotypic spectrum. The diagnosis of RLS is made by clinical history. You don't need a polysonogram, you don't need an MRI, you don't need a clinical examination, just to talk to the patient and listen to him or her. And there are 4 essential criteria that we can define what is RLS. The first criteria is an urge to move the legs, usually associated with an unpleasant sensation that begins or worsens during periods of inactivity, like sitting in a chair or laying in a bed, and is relieved by movement, like stretching the legs or walking, and begins or worsens in the evening or at night. This is why some patients with RLS complain because of insomnia. We have some characteristics of RLS, like it affects all ages. RLS occurs in children, in adolescents, in adults, in the elderly, but we know very well that the incidence increases with age. It's more frequent in women, and it affects about 5 or 10% of the population with a very characteristic and typical geographical distribution. For example, it's more frequent in the western countries of Europe than in Asia. And it's also a very striking thing is that 60% of the patients with RLS that you have in front of you will tell you that one of his or her relatives are affected by the same symptoms, probably at different degrees of severity, but the same quality, the same type of condition. We also have another characteristics, like RLS has an unpredictable course. It can be stable in some patients. Some patients may tell you that they have some remission during months or even years. In other patients, they'll tell you that the symptoms are progressive. And there are some difficult cases, but they are refractory, that we call refractory forms, that they are refractory to any kinds of medications. We know very well that there are secondary forms. We have the idiopathic form, the familial form, and the secondary form, and it can be divided in 3 conditions: iron deficiency anemia, renal disease, probably in the end stage renal disease, and pregnancy, usually at the 3rd trimesters. And these 3 conditions, iron deficiency, anemia, renal disease, and pregnancy, are characterized by a common thing, a common aspect, which is iron deficiency. Also, we have some form that we can call iatrogenic form, which is induced by some medications like dopamine blockers, antiemetics, for example. When you ask to a patient, how can you describe your funny sensations that you have in your legs in one word, some of them will tell you that it's called irritating or painful or crawling, uncomfortable, discomfort. 10% only will tell you the word restless, 10% tingling, and 10% twitching. As you can see here, there's a sensory component of the description that they have in the leg.